Good afternoon. I'm Dave Herrero. As Arkell noted, I'm a partner at LSG. I'm bringing a little bit of a different perspective this afternoon. LSG is an impact agency, as we like to say. And I work in communications, public affairs. I've worked for probably about 200, 300 clients over the last 10 years. My background is in politics. In the last 20 years, I've worked in politics and several years in the US Senate on Capitol Hill. Now live in Denver, Colorado, and I am incredibly pleased to be joined by our former mayor, Michael Hancock, who served for 12 years as the mayor of Denver. And he led the city through truly tremendous moments of change. Economic change, social change, political change. The pandemic was a moment. The city saw a bubbling and bursting, ultimately, homelessness crisis. We were just chatting about how quickly the city and massively the city has grown just from a population standpoint. And he also saw the intersection between local and national, and served as mayor at the time in which there were 3 different presidents. So started under President Obama, moved to President Trump, then President Biden. And so I think there's a real opportunity, and what I'm really excited to talk about today is how to navigate change, and particularly significant moments of change for folks that are doing really impactful work at the local and community level, at the same time that we are experiencing huge and dramatic and fast changes at the national level. At the same time, I think there's an opportunity. I would really like, if I have one message for folks today, I want you to leave feeling optimistic and empowered, even in the current environment. There is an opportunity to tell your story, communicate the impact that you're driving, and I think it really derives from a local ground-up approach. And I think no one knows that better than a mayor. And so I think we're really excited to have this conversation today. Mayor Hancock, I wanted to maybe level set just for a moment as far as kind of where we're at, because I mentioned this context politically, what's happening in Washington. I think we need to take a sober look at the reality that what is happening in Washington is changing every aspect of life. We are seeing a redefinition of federalism. It is changing the dynamic between federal, state, and local powers. And President Trump has really come in with a lot of momentum. And I think in a way, I mean, he won the popular vote. He won every battleground state. He likes to say that he has a mandate, and he is operating like a man on a mission. And so what does that mean for organizations in this room and folks that are doing work at the local and community level? And I think what it means to start is that more responsibility, but also opportunity, is going to fall to local actors. And it's folks working at the intersection of community and health and social care and cross-sector partnerships, and that's where there's real opportunity. And so, Mayor Hancock, I wanted to start and just get your perspective. As you look at your experience for 12 years as mayor of a major growing city, experiencing all these different moments of social, economic, political change, are there insights and lessons that you can offer to folks operating at the local community level here?
Yeah, first of all, good afternoon, everyone. And Dave, thank you for that tee up. That was phenomenal. Can we do something for a minute? First of all, you look good up there. I was just looking at that picture.
Hey, thank you.
I was like, is that the same
that
dude?
That was a professional photographer.
That is good.
So
can we give Go Blooming Health a round of applause for just putting this event on? And I mean that because we come together, talk about the very things, how wonderful and amazing the timing is for this conversation, right? And this is what I'll say to your question, and I'll demonstrate it as well with a quick illustration story. But the reality is that when push comes to shove, just as we saw during COVID, when the backs of this nation and its people are against the wall, particularly when it comes to macro issues like health and health care and the well-being of its people, it's at the local level where we are able to get innovative, we're expeditious, and we're able to deliver. And let me give you an example that kind of demonstrates how, as mayor over 12 years, 20 years in public service, but 12 years as mayor, that I kind of came to see the various levels of government. And this is a true story about some young people who were climbing up an embankment or overlooking a highway and throwing down, picking up the garden rocks and throwing them down the highway at cars passing on the highway. And you can imagine how dangerous that is, right? And so the public safety director, the police chief, and the public works people decided they would climb this embankment and kind of see what's going on and what they need to do to remedy the situation after a couple near tragic accidents. With the police chief was a young police officer. And the public works engineer, the public safety director, the mayor, and the police chief were up there looking at all these rocks and trying to figure out how they were going to address it. And they're looking around, and they're coming up with all these complex concepts. But the young officer was just sitting there looking at them like, this is actually pretty simple. And in public works, right, we can get these big earth movers up here and we can move these back, we can put a fence up, blah, blah, blah. And so finally, after about 15 minutes of this rumination and bloviation going on, the young officer hesitantly, timidly interrupted and said, can I suggest something? To which the police chief very gruffly, let's say he represents the state, the police chief represents the state, very gruffly said, what is it you want? To which the young officer said, why don't we just move the rocks? The young officer represents local government. Quick, innovation, simple, close to the people. The mayor, the public safety, the chief, they represent the federal and state. Everything is a little more complex than it has to be. And what we saw during COVID, to answer your question, is local governments really led this nation through, into, and out of COVID. Yeah. There were no conversations about policies or politics. It was about data. We needed to do certain things to protect the people. And as we approach public health, as we approach the broadness of public health and all that's involved in public health, quite frankly, I find mayors and local government leaders tend to be the ones who are the most knowledgeable and engaged because they know their people best.
Yeah, yeah. Well, and I feel that as a constituent of Mayor Hancock's, and we see this. We do research regularly, and in the elected official space, it's your mayors and city council members that have the most trust. And I like to think it's because they are the closest to a community. Yeah. And they're the closest to the ground. And Mayor Hancock, you kicked this off by telling a story, and it reminds me of the power of storytelling. And it's simple. You don't need to be a masterful communicator. You don't need media training. But it's all about finding narratives and making personal connections that connect to the narratives and the issues that people care about. Mm-hmm. And so I want to talk for a moment about that message and what is it that we effectively can say. Our company, we've been doing public opinion polling for years and years. And we've really been digging in the last few months just to understand where is public sentiment right now? What are the issues that are really resonant among the public? And has that changed at all since the election? And there's a few opportunities that I want to highlight for folks in the room here, because I think there are opportunities for you to connect the work that you're doing and the missions of your organizations to the issues that the White House is paying attention to and that the public says they really care about. And the first is lowering costs, and I think we all saw this. President Trump won probably on the #1 issue of tackling inflation and lowering costs, and he attacked President Biden on this, and that issue is still very resonant. And I heard stories this morning, there are innovative programs and approaches that people are doing to drive down costs, to make care more efficient, to take actually the burden off of the federal government and take it on to solutions-oriented community programming. So I want to really encourage folks to lean into that. That is a resonant message in this environment. The second opportunity, I think, is around entitlement programs. We know this: Medicare, Medicaid, Social Security, but Medicare and Medicaid. Those are the two issues I want to focus on, because there's clear constituencies, and there's constituency politics, I think, to leverage and think about as an opportunity. There are diverse populations served by these programs, and there is generally real social sensitivity to changing and cutting these programs. Yep. And so I think the more you can show the ways in which you are collaborating and supporting and enhancing those programs, I do think that's actually going to help at the federal level, and as the debate actually becomes more and more complicated in the coming months. The third issue that I want to highlight is around institutional mistrust. Americans more and more distrust government, but it's not just government. It's corporations, it's the media, and this is a real opportunity for you all to show where you are creating solutions and where you're helping to combat and bring in non-traditional community-based approaches. Those are the approaches and the solutions that Americans are hungry for. And then the last one that I want to highlight, and then I've got a question for you, teeing this up, is around this MAHA agenda. And this came up this morning. You know, we talked about food nutrition and opportunities in that space. You know, the Make America Healthy agenda, it's not just a slogan. This is the way, this is the strategy in which the federal government is changing its relationship with health and social care. And it's connected to issues that really matter. You know, chronic disease management, food nutrition reform, getting pollutants out of the environment. I mean, these are all opportunities as I hear and as I talk to folks about the programs that you're leading to plug into that agenda. And that's a priority for President Trump and his health secretaries. So my encouragement to folks would be, think about unexpected ways in which maybe your work actually connects to priorities of the president and priorities of the White House and this current administration, because I think the real opportunity for the next 4 years is not to just look at this as opposition and roadblocks, but how can we create bridges and opportunity? And so that connects a little bit to my question to you. You obviously oversaw Denver. Denver's a solidly blue city. It grew significantly and has only become that much more so in the last 10 years. But Denver's surrounded by purple and red counties, and it's part of what made historically Colorado be seen as a purple state. And I'm just curious if you saw in your time as mayor moments that surprised you as far as kind of cross-partisan and cross-party opportunities that also supported your agenda and the issues that your constituents cared about as mayor.
Yeah, I'll tell you, we saw it really even more clearly during COVID.
Yeah.
You know, and there are two things I want to make point. Let me, before I answer that question, go back to something you talk about, and that is the mistrust of government.
Yeah.
And one of the things that I'm most concerned about during COVID, we saw the levels of mistrust within the public health system so clearly. I became a talk show host, virtual talk show host, and we were targeting certain communities. Asian community, African American community, Latino community, aging community, the LGBTQ community, because people didn't trust what government was saying in terms of public health. And so we got trusted stakeholders, if you will, community-based organizations, doctors, nurses, to come on, and we held these virtual town hall meetings targeting certain communities to try to break down those walls when it came to vaccination and why distancing was so important. But that took a lot of time. I mean, I would go home from the Emergency Operations Center in the city of Denver, and I would hold virtual meetings with these communities. And it just underscored for me how really there was such an amazing distrust in public government. But during COVID, to your question, Denver is the capital city of Colorado. We are a strong mayor form of government. All the other counties, our cities around me, except for one, is a council manager form of government. And so the mayors couldn't make the call. If I said we're shutting down restaurants for public health reasons, I got the data to prove it, we're shutting the city down, which I had to do, I could make that call after declaring a state of emergency. Well, those mayors couldn't do that. They had city managers and they had county commissioners and so on and so forth. And so I would get on a regular regional call with them, and what was amazing to me, it didn't matter what party you belonged to, it didn't matter what city you were representing. The reality is that we were all in the same boat. We were fighting something we couldn't see, something we couldn't smell, we couldn't touch it. We knew, though, it was taking lives. It was making people very sick, and it was taking lives. And we had to make decisions to protect our people. And so they would say, someone said one day on the call, Mayor, we will follow your lead. And I said, and there was a consensus that we need to shut down our metro region. We need to shut our cities down, get people home, get them safe so we can deal with this. Well, the governor wasn't quite there. He has a different constituency. It's us plus the rest of the state. And we consulted with the governor and said, we need you. We would rather follow your lead than to do this as a region independently. And he couldn't make that call. And so the mayor said, Mayor, we'll take your lead. I said, folks, we're gonna have to make a tough call here and go contrary to where the governor is. Let's shut our region down. And they did, we did. And tough call because we knew we were changing lives, we were impacting people's livelihoods, we were changing the way we all lived. Hardest thing I ever had to do as a mayor was to shut down my city and shut down the region. But to your point, nonpartisan, it was about humanity, it was about keeping people safe, and it was about doing the right thing because it's never a wrong time to do what was right.
Well, and that raises for me, I think, the question of you know, we're talking about what to say, but also really importantly, who to say it.
Right.
And it's so connected to this idea of trust. And I think the opportunity here is that so many of the trusted voices these days in politics and healthcare, they're folks that are on the ground. They're folks that have, you know, the pulse of local communities. They're small business owners and their employees. They're firefighters and EMT professionals. They are veterans. They are working professionals and families, a category that has grown so much more diverse than the way that it used to be talked about. And this is not just, you know, workers in the Rust Belt anymore. These are Uber drivers and you know, gig economy workers in Nashville. These are hospitality workers in Las Vegas. And so, and then you look beyond that and there's, you know, a whole new class of non-traditional media. You've got podcasters and social influencers. I'm illiterate at TikTok, but I know it matters. And there's so many different means of getting a message out there, but really I think who says it is important. And there's an opportunity, I think, for everyone here that's so closely connected to the ground. Those are the messengers that really matter and that really are trusted. And so I'm wondering, Mayor, a little bit to this point, you know, as you look at COVID and you look at you know, who you relied on, because you can't ever do these things and solve these problems alone. You know, were there particular partnerships or constituencies that you relied on to support your agenda or to, you know, build coalitions?
Well, in terms of just public health or throughout COVID?
Broadly, yeah.
Yeah, well, I think, first of all, I think your point in terms of who delivers the message is very important. When I became mayor, we had a department, it was the Department of Public Health and Environment. You put a political appointee in there. After 4 years, I realized if there was something happening in our city and I needed a credible voice on public health, this individual was not the one. It was nothing against him, he just wasn't a public health expert or a public health professional. He was a government appointee, political appointee. And so when I got reelected, I removed him and appointed a public health appointee. So it was important. He was the most, I don't know about your cities and counties, but the most important person during COVID for me was that public health director. I was incensed, embarrassed, and disappointed in how politics played a role in a lot of the decisions that had to be made. People were dying. And I don't know about you, I stopped counting at 19 people that I lost during that time. Yeah. It was painful era of 3 years, 3.5 years of losing family members and friends. Not all the COVID, but it was an era of loss, right? And one of the things I made the decision on very early on with him, he and I sat and talked, and I said, Bob, you will be my guide. We will make decisions based off of data. You're gonna provide that data. And once you provide that data, I wanna know what you recommend we do, and then we'll make a decision. I will be the one who'll stand up and say, here's our decision, but you're gonna be next to me. And we will always do that. And so whenever I stood up and spoke to the public about a decision we had to make, it was always data-driven. I always had Bob with me, and he always spoke. And we had maybe a medical director for the public health hospital, Denver Health and Hospital with us, to back up what we were saying, that this was the right decision. But we had to prove, we had to prove to people that we were not playing politics, that these decisions were being data-driven. I'll tell you one time we stepped out of that box, and one of the most funny moments, I'm gonna make money off of this someday. I was at a press conference and we were shutting down basically public restaurants and things of that nature. And remember, before we do these press conferences, you try to imagine every possible question you can be asked, right? It's like a football game. I'm the coach. We're trying to imagine every scenario they're gonna throw at us, and we gotta counter it somehow and have an answer for it. And if you don't have an answer, you say, I don't have an answer. Well, I forgot that rule. It's a very important rule to have. It's okay to say, I don't know. We'll get back to you. Well, great press conference, going well. We're about 3/4 of the way through, and someone raises their hand. You know, Colorado was the first state in the nation to go live with marijuana, recreational marijuana sales. And someone raised their hand and says, does this mean that marijuana stores and liquor stores are closed? And I looked over at my city attorney who was behind the cameras, and she looked at me and she said, I said, yes, liquor stores and marijuana dispensaries will be closed. Folks,
I remember the lines.
I was not off of the platform, right, Dave?
Oh my gosh.
And there were lines at the weed stores
as much
and
as
the liquor stores. It was the most amazing thing. Helicopters up in the air, and I stepped off, and we went to the back room where we began to debrief. And my deputy chief of staff looks at me and says, Mayor, there are lines forming. It wasn't 5 minutes. Lord, people were lying. I wanted to go get my liquor, but I couldn't. I was in the emergency operations center. But people formed this line, so they're now T-shirts walking around. I survived Denver's, what do they call it? Denver's,
the shutdown, or who knows?
The moment we couldn't buy liquor. What is that? What's that called? Prohibition.
There we go.
I survived Denver's prohibition. And I finally, someone gave me, that was 5-6 years ago. Someone walked up to me at an event recently and gave me one of those T-shirts. Because I never got one. People have been selling them.
I mean, full circle moment.
Yeah.
And what he's saying is completely true. I remember the lines, and they were just as long for both. You're reminding me a little bit.
Well, we got to find out who all the potheads were in the city. That's for damn sure.
Right, totally.
Some of them were on my staff.
So I have a question, because I want to connect this to everyone in the room here. Can I see by a show of hands, who here has ever met with your mayor? It's actually more than I thought. That's great. Mayor Hancock was telling me backstage how many people he got phone calls from when he was mayor who were in Washington. And it was our members of Congress, it was our senators, it was Diana DeGette, who's the congresswoman for Denver. But I mean, it was truly, you were rattling through names. And it occurred to me how much, I used to live in DC, I worked on the Hill, and the flight was brutal. I was working for a member of Congress at the time from California, and the reality is that you're disconnected. It is hard to have that job, and so you are relying on local surrogates to help you keep a pulse on what's going on. And it reminds me a little bit that I think to connect this all together, there's an opportunity now. We're early on in President Trump's second term here. And truly, he is moving quickly with executive actions to make policy changes, and that's going to continue to happen. But the reality is, it's also some of that's starting to get mucked up in the courts. And so, we'll see exactly the limits of that policy-making lane. I think more and more, in the next 6 months at least, as we look at this battle over reconciliation and spending, the battle is really going to shift over to the legislature and to Congress. And the truth is that Republicans in Washington are operating with the thinnest legislating majority since the 1930s. In the U.S. House of Representatives, it's 5 seats. That means it only takes 3 members of Congress to vote with a unified Democratic Party in the House to sink or change a bill. In the Senate, it's 3 votes. So how do we get to that point of changing that math and persuading the individuals to go out there and give them air cover, if they're a Republican, to vote no, or to stand up to the party? And the reality is, it takes storytelling, and they need to hear from people like you. And so my message, I think, to all of you is meet with your members of Congress, meet with your governors, but meet with your mayors and your city council members, because they are taking their stories and taking your stories directly to legislators and policymakers in Washington. That story, you need to tell it not just once, but multiple times. You need to do it in meetings. You need to do it at community events, even in the media. And when done right in the media, it actually doesn't necessarily need to be controversial or adversarial. And so I think there is such an opportunity here. Keep it simple. do what you do best. You all are armed with the impact-driven stories of what you do, but people need to hear it, and your representatives need to hear it. And so, Mayor, I'm wondering, as you know, you communicated and shared that with me backstage. Are there any lessons that you would leave the crowd with as far as, you know, how they can use their voices and leverage their power and what they're doing at the community level to drive influence at the city, state, and national levels?
I think you said it, and the other best advice I would give is to keep it simple. I'm on the stage tonight, and with an advisor to Blooming Health because of a personal experience. I lost my mother 2 years ago. She was 84 years old. She was sick, but I'm the youngest of 10 children. And so, but we learned that there were some things that when she got sick, that she was not, some services she wasn't receiving. And we spent, all of us, an inordinate amount of time just trying to connect her with services that she was eligible for. And and it shouldn't be that way. It shouldn't be that difficult. And unfortunately, I'm the youngest of 10, like I said. So as family, there are a lot of us working to do this. Because not only that, she had 41 grand and great grandchildren when she passed. So all of us are working, connecting her, getting what she needed. It still took a lot of time. And I thought, this really sucks. Yeah. This is my mother. I'm the mayor of the city. I know a lot of the things. But there's still some things I didn't know. And just imagine if there is an older adult, and I appreciated the New York State Director's, Public Health Director's comments today about aging. Aging communities don't have that. Yeah. And not even just aging, but people with disabilities who don't have it. And I have a granddaughter on the spectrum. And her parents, my son and his partner have done a phenomenal job finding services for her, but it's too hard. Yeah. And so keep it simple. Find ways to imagine, put yourself back on the couch. As I would always tell my staff, don't forget to imagine what the person on the couch is thinking, because ultimately that's what you're dealing with. Yeah. And that's what you're modeling policy for. Keep it simple for them. It'll be simple for you as well. And we got to get back to the basics of humanity and keeping it simple and make sure people have access to their services.
Yeah, completely agreed. Well, I think that's a great note to close.
That's why Blooming, Go Blooming is so important.
All right. Thank you, Mayor Hancock.
Thank you.